Shut up and sit down.
In order to develop a teaching model for demonstrating issues caused by malalignment of orthotic knee joints, we thought about the tools every orthotist has readily available.
When the mechanical axis is situated posterior to the anatomical axis, the thigh strap moves proximal and anterior during flexion and distal and posterior during extension. When the knee is flexed, the leg experiences pressure at the posterior calf and the posterior thigh. Here is a demonstration of the previous information. When the mechanical joint is situated anterior to the anatomical axis, the thigh strap moves distal and posterior during flexion and proximal and anterior during extension. When the knee is flexed, the leg experiences pressure at the anterior calf and anterior thigh. Here's a demonstration of the previous information. When the mechanical joint axis is situated distal to the anatomical axis, the thigh strap moves proximal and posterior during flexion and distal and anterior during extension. When the knee is flexed, the leg experiences pressure at the posterior calf and the anterior thigh. Here is a demonstration of the previous information. When the mechanical joint axis of the KFO is situated proximal to the anatomical axis, the thigh strap moves distal and anterior during flexion, and proximal and posterior during extension. When the knee is flexed, the leg experiences pressure at the anterior calf and the posterior thigh. Here's the demonstration of the previous information. When the mechanical joint axis of the KFO is situated in exact alignment with the anatomical axis, the KFO and leg segments move together. The straps stay in the same location on the thigh and apply appropriate pressure both in flexion and extension. Here's a brief demonstration of the previous information.
Begin swinging. What happens when your orthotic doesn't have a knee joint? First of all, we don't care because it's not a KFO. Next, it's not an orthotic. This is an orthotic.